And action! Hey everyone, Joe had a question on recreational marijuana, and I have done videos on medical marijuana, so please see DrRic tutorial medical marijuana 1, 2, and 3 for ideas. But there I talk about its use for medicinal reasons, and Joe had a question about recreational. I do have a lot of patients that use it recreationally. So I just wanted to point out a couple of things, if you are a recreational user, on why you should be aware. So I did a little bit of a chart here, and this is what happens as you get older. You start as being a kid, and then you become a teen, and then a young adult, then in your 20s and 30s, 40s and 50s, and then 60 and beyond. I have a lot of 80-year-olds, but just for the sake of my questions here, or my question and answer, we'll just talk about this timeline. You start with being dependent on somebody, then you go into independence. And unfortunately, some of us go back to being dependent again after that, especially when it comes to health issues. But you go from these stages of dependence to independent by going through these milestones. You go through milestones, you learn coping skills. Socially, you interact, you learn from your interactions and your challenges, whether it's through school, peers, or sports, or other things as you get older. But in pediatrics, we call them milestones because at every stage of developing from 0 to 12 to 18 years of age, there's milestones that we expect. If you don't hit the milestone, typically you can't go on to the next milestone. For example, physically, a child will start to pinch and then grasp and then have control where they'll switch hands, or they'll start to look up and then they'll hold their head straight and then they'll stand up. That's the way it works usually. And if there's a deficiency or a hit where a milestone doesn't occur, you usually can't progress on. And as doctors, it gives us a warning sign that we should check out, well, why is it so delayed? Is there a reason for it? Well, socially, there's also other things that we expect as well. And when most of my patients use recreational marijuana on a nightly or a couple of time a day basis, that is usually because of stress. The number one reason that people would use medicinal or recreational marijuana would be usually at night because they can't sleep or because stress is high. Now, in the soldiers coming back from service, there is a very high occurrence of post-traumatic stress disorder. And again, that's one of those things that you accumulate as you get older. And that's a milestone you don't want to have. But unfortunately, those that serve and protect us, they do have to go through that. And it's very unfortunate that I believe the statistic is about 20 soldiers will commit suicide every day in the United States because of post-traumatic stress disorder. And we should really be aware of that. But the use of recreational marijuana does soothe those symptoms. If you look at my video, the way marijuana works is it works through an endocannabinoid system. There's actually a bunch of receptors in each of our cells, in each of our trillion cells, that has a function of responding to an anandamide, or at least THC or CBD. THC or CBD are two components called cannabinoids. And the cannabinoids that you get from marijuana, medical marijuana or street marijuana, can either stimulate the THC receptors, which are mostly the psychoactive ones that give you the high kind of feeling, or the CBD receptors that give you the anti-inflammatory effect. For my fibromyalgia sufferers, I like to use a little bit of both. But for post-traumatic stress disorder, my guys would, or my servicemen and women would use it for helping with the trauma that the brain is going through. That is unfortunately a learned a milestone that occurs from the exposure to death and war and killing. And sometimes when you have that exposure, it's a traumatic one. I didn't put it here, but it prevents you from going on to other things later on unless you neutralize it. Just like here, if we have a problem that develops along the timeline, sometimes socially, if you fix that reaction that you're having, you can kind of get on to the next milestone. If that reaction you're having that prevents you from going into other social gatherings or speaking out loud in front of groups or flying on a plane or getting into a large, just a large gathering or getting into water, these are all reasons for fear, unusual fear, sometimes paranoia and anxiety. And sometimes if you get to therapy, which you should be doing, if that doesn't help, then sometimes using the medical marijuana or recreational marijuana can get you a little bit of a band-aid so you can proceed on to the next milestone. And that's essentially what I want to talk about is when you're using recreational marijuana to that extent, it's okay if you have a diagnosis like our servicemen and women. And for that, you need to have a treatment plan, and that would be great if you can get medicinal, but if you can't, then you're defending yourself or protecting yourself with, as best as you can, marijuana. It's okay, but don't just rely on the marijuana. Always get help because there's other things you can do with post-traumatic stress disorder. My talk is not on that, it's on why I think we should be careful with using recreational marijuana. For folks that don't have post-traumatic stress disorder, folks who have just the need to try to get to sleep because it's tough to get to sleep. Well, that's fine to use recreational marijuana to kind of smooth you into sleep, but you have to figure out, I have to be the lifeguard who says, well, why do we need it? It's a very potent drug. It is a drug, and it's a very potent drug that is calming. It helps you, again, to go back to my servicemen and women, helps you forget about trauma because it affects memory, the temporal lobe. It helps you relax, gives you euphoria. It stimulates different parts of the brain, the amygdala, the nucleus accumbens, different parts of the brain get calm. And when they get calm, you can interact better. But for my folks who don't have post-traumatic stress disorder, just need it for sleep, I have to ask the question, is this sleep being interrupted because we have a sleep disorder that we haven't diagnosed, or possibly an anxiety disorder we haven't diagnosed? So if you have one of those two, specifically an anxiety disorder that we haven't diagnosed and you haven't treated with either a psychologist, cognitive behavioral therapy, guided imagery, a mindful practice, then you're shortchanging yourself just going for the big marijuana hit at night. So sometimes an anxiety disorder right here, somewhere along the line, for whatever caused the anxiety, will not allow you to progress. So you have to be careful that as you try to get older, go through the usual social progression, the social milestones, you might be shortchanging yourself. If you're needing the marijuana to get to the next milestone, probably okay, but as you saw in my pyramid, there's a whole bunch of milestones that continue on into even adulthood and old age. And if you haven't addressed them the proper way, then and that's usually psychotherapy, everything I just mentioned, and you're only using the temporary band-aid every night, you're going to hit the wall eventually because age always happens. You always get older, and these social interactions always get challenged or get presented to you later on. So if you don't deal with the anxiety here or here, then you're going to have a problem where you're going to have to deal with it later, and you've got a whole bunch of other things that you got to deal with on top of that, like other health issues. So you might as well try to deal with the reason, or figure out the reason that you're using the recreational marijuana. It's kind of like alcohol too. If I have somebody that uses alcohol socially, like on weekends, I think that's fine. Weekends, social gatherings on the weekend. But if we need 2 to 3 beers every night, especially as you get older, or you develop reflux, or your liver is getting too high, or you're gaining weight, that's a lot of empty calories. I'd say let's try to figure out why we're doing the alcohol and maybe cut that out, or get the proper treatment before it slaps you in the face because you cannot proceed to the next milestone. Well, the same thing with the marijuana. If you're smoking, you probably shouldn't be smoking. I'd probably consider vaping. You can get the same fast hit if you do it. That's usually the THC component gives you a fast rise and then it drops you down. Hopefully you're asleep at that point in time. But the smoking part, it exposes you to carcinogens and lung cancer. If you vape it, a little bit less of that carcinogen part. If you eat it or you use the topical, it's a little bit slower, so not too many people that have, say, anxiety or insomnia can wait for that slow response of the recreational marijuana. So it's just food for thought that if you are using something on a nightly basis or a couple time a day basis, I mean, it's a beautiful thing. I have a lot of people that use recreational marijuana and they work better, they interact better. Some artists can actually compose more because their inhibitions, again, going with the amygdala, nucleus accumbens, the hippocampus, all these parts of the brain. Sometimes if you've developed inhibition or anxiety issues, the use of recreational marijuana will stop those bridges that are closed. It'll open up the roadway, it'll make you perform or make you forget about those blocks that you have. So it's okay to use it, but if you need it pervasively throughout your life, you probably should get to one of us to see if there is a roadblock that might not have been addressed the usual way. And there's nothing wrong with seeing a psychologist. I think there's very good positive psychology that we can take advantage of now that helps people get through stick points, especially if your life happened to be tougher than the average life. And there is not one perfect life. Everybody has their challenges, but sometimes when the challenges accumulate and or the genetics are there, it might make you react in a way that isn't well received by the culture, and you tend to feel a little bit withdrawn. Thus the reason for the gravitation to the recreational marijuana. So don't think that you're doing anything bad, but do get it investigated, either by talking to your doctor, your primary care doctor, or I like searching out for a counselor. If you look at Psychology Today, that's psychologytoday.com. That's a magazine, but a lot of psychologists and counselors in your area, it's a nice search engine that they have. You put in your zip code, it'll come up with a bunch of different names and faces. And I particularly like the faces and the names that have a little bit of mindful practice in their repertoire, especially if it's mindfulness-based stress response teaching by John Kabat-Zinn. Perfect. But I would always, in addition to cognitive behavioral therapy, EMDR, just couch time, I think teaching somebody mindfulness practice is also very useful for not only the social problems that might be a challenge, but also to calm down that inflammatory response that we're always faced with those invisible stressors of the day. So great question, Joe. Hopefully the rest of you, if you do have any other questions, can zip over to my tutorial on medical marijuana and send in more or chat down below.